Hi guys, this is Dr. Martin. We're talking about scar therapy. Anytime you have on your treatment plan scar therapy, that's really a long incision that we're really worried about it healing poorly. So we use lots of different products. I like to think we've gotten better over the last 25 years in our surgical techniques that we've been using to provide a great scar, but we really have to rely on some ancillary products. So what does that mean? Well, we're going to use better suture. We're going to use a quill suture or a stratific suture. What does that mean? Well, the old suture is typically a needle and thread. With the new stratific suture, it's a needle and thread, and on the thread it's got these little three-dimensional barbs. So the theory is, as you're suturing it underneath the skin, the body's actually locking that incision together. So as the body's wanting to dissolve that suture and get it to go away, it won't allow it to widen out as much. So our incisions have been as narrow as they've ever been. The second thing we're going to do for you is to draw blood off you at time of surgery, spin it down, get the growth factors out of it. That's called PRP, platelet-rich plasma. So we're going to inject that along the wound site to help you heal better and stimulate the growth of the blood vessels and the collagen in that area. Next thing we're going to use is a product called Preneo. It's like a Steri-Strip, so if you've seen a Steri-Strips, we put that on, but the problem with Steri-Strips, they're breathable. Stuff gets in and out, stuff bleeds through. Preneo is like a Steri-Strip, but it's glued in with Dermabond. We like to keep that on for 15 to 21 days, and once again, that's holding that incision together and not allowing to widen out. And it really creates a no-mess technique, allowing those incisions to be nice and clean. Next product we're going to use is an oxygen dressing. This is one of the newer things we're doing. An oxygen dressing is a dressing that we put on for 30 days. It's feeding you concentrated oxygen 24 hours a day around the clock on that wound site. So it really improves the pain threshold, or how much pain you're going to have. It really improves the scar formation. So we're trying to keep that on for about 30 days. And after we get done with all that nonsense, then we're going to go to silicone strips. We love silicone strips. Silicone strips will lay scars down as flat as possible. We try to encourage the patients to wear those for about 3 months in total. So they're reusable strips that we use 12 hours a day for about 3-month time frame. So those are all the ancillary things that we're using to try to have a great scar, because you could have a great procedure, but if you don't have a great scar, then it's not a great procedure. So come in and see us and we'll get you taken care of.